Uh, Myself, Dr. Archit Dahiya. I'm a consultant cardiologist in the Holy Heart Hospital, Rohtak. And the topic for today's presentation is understanding heart attack. In today's session, we will discuss about the heart attack, its causes, and preventive measures needed to avoid heart attack. Nowadays, we often come to know that the person died due to heart attack even at the age as young as 30 and 40 years. Incidences of heart attack and number of deaths due to it are constantly increasing in India. So let's understand what is heart attack and what can be the reason behind it. Heart is the most essential organ and its non-stop functioning is crucial for survival. It functions like a pump and allows the circulation of blood throughout the body. Blood circulated throughout the extensive network of various types of small and large blood vessels. Blood ultimately provides all the nutrition and oxygen support to various organs which are necessary for normal functioning of the particular organ. The muscles of the heart continuously contract and relaxes to pump the blood into the blood vessels. The pumping of the heart leads to what we can hear as the heartbeat. On an average, in a healthy normal person, heart beats for around 60 to 100 beats in a minute. That means heart muscles contracts and relaxes 60 to 100 times every minute. To do such an extensive work non-stop and that also without any interruption, it requires continuous supply of oxygen. For these, heart had its own network of blood vessels around it, which continuously supplies oxygen to the various heart muscles, known as the coronary arteries. Any interruption of blood or oxygen supply to the heart for even a few seconds can impair its functions and leading to heart failure or heart attack. Basically, a heart attack occurs when a blood vessel supplying blood to the hearts are blocked. Now let's understand why there will be blockage of blood vessels. Main reason behind such incidences is increased blood pressure and excess of cholesterol and fat deposition in blood vessels. Persistent high blood pressure damages the blood vessels by making them more rigid and by damaging the inner walls. This increases the risk of cholesterol fat deposition in blood vessels. When there are excessive fats, it get deposited in the inner walls of the blood vessels. It blocks the blood flow. Due to these blockages, heart of the person with high blood pressure has to work harder to pump the blood throughout the body. This increases the workload and oxygen demand of the heart. The increased demand and lower supply of oxygen due to the blockages ultimately lead to the failure of heart function. A heart attack may be caused, may have multiple symptoms. Chest pain is the most common symptom of a heart attack. This can feel like an uncomfortable pressure, aching, numbness, feeling of squeezing, fullness, or pain in the chest. This discomfort can spread to the arms, neck, jaw, or back. It can last for several minutes or come and go. However, it's not the only symptom. Possible symptoms of heart attack are dizziness or fainting, lightheadedness, nausea, indigestion, vomiting, and shortness of breath. These heart attack symptoms can be different for each person. No two heart attacks are the same, even for the same person. Person may have just one or combination of symptoms. Sometimes the symptoms of heart attack are not the classic crushing chest pain that one thinks of. One may feel less obvious symptoms such as burning feeling in the chest and shortness of breath. Sometimes one may have no warning sign symptoms at all. A heart attack is a medical emergency. A heart attack can only be diagnosed by medical test. The only way to know what you are experiencing is to seek urgent help. Medical test includes the first and the foremost ECG, also known as electrocardiogram. It can provide information about the extent and location of a heart muscle damage. It also detects the heart rate and rhythm and whether or not one is having a heart attack. The next investigation is echocardiography. It is an ultrasound test that can be used to learn how the heart is pumping overall and what areas might not be pumping normally. The next one is coronary angiography, also known as coronary catheterization. It is an invasive test performed to directly visualize the size and extent of blockage in the blood vessels of the heart. It is frequently recommended in the first hours of a heart attack if medications are not relieving the symptoms. The next is blood tests. Overall, all these tests will also measure the amount of damage caused to your heart and the best treatment course to take. A heart attack mostly requires emergency treatment to restore blood flow to the heart. The faster this happens, the less the heart muscle is damaged. Heart attack treatments may involve medication or surgeries. Medications can be drug therapy, aims to break up or prevent blood clots, stop platelets from collecting and sticking to the plaque, stabilize the plaque, and prevent more ischemia. Take these medications as soon as possible, ideally within the first hour, and to limit the heart damage. Drugs used during a heart may include aspirin to stop blood clotting that may cause the heart attack worsening. Other antiplatelet drugs such as clopidogrel, prasugrel, or ticagrelor to stop clotting. Thrombolytic therapies to dissolve blood clots in your heart arteries, or any combination of these. Other drugs given during or after heart attack help your heart work better, widen your blood vessels, lower your pain, and help you avoid life-threatening heart rhythms. Drug therapy aims to break up or prevent blood clot, stop platelets from collecting, sticking to the plaque, stabilize the plaque, and prevent more ischemia. Take this medication as soon as possible to limit the heart damage. One can reduce the risk by making positive changes to your lifestyle, such as to treat the blood cholesterol. Foods higher in saturated fat can contribute to high cholesterol and reduce the blood flow and increase risk of heart attack. Hence, it is also important to start a healthy heart diet to reduce the risk. And to limit foods high in saturated fats, which comes from animal products such as cheese, fatty meats, dairy desserts, tropical oils, and highly processed foods. We should choose unsaturated fats which don't raise cholesterol levels. One can find unsaturated fats in foods like nuts, fish, vegetable oil, olive oil, and sunflower oils. This diet emphasizes increased intake of food, vegetable, whole grains, poultry, fish, and nuts while curbing sugary foods and beverages. Eating and drinking too much sugar raises the triglyceride level, so we should avoid too much sugar in our diets. A healthy heart eating plan can help manage the blood cholesterol level. The next is controlling the high blood pressure. Drinking too much alcohol can raise the blood pressure. It can also add extra calories, which may cause weight gain. Cigarette smoking also raises blood pressure and put you at a higher risk of heart attack and stroke. Excess salt intake is also known to raise blood pressure. Reducing these factors can help to reduce further complications of it. And lastly, we should follow an exercise plan and maintain an ideal body weight. Regular physical activity makes the heart stronger. If one has a strong and healthy heart, it can pump more blood with less efforts, reducing the risk of hypertension and failure. Exercise cuts bad cholesterol levels and raise the good cholesterol level. One can aim to get 2 hours and 30 minutes of moderate aerobic activity per week, like brisk walking, or 1 hour 15 minutes of high intensity exercise, such as jogging per week. Monitoring stress level and getting adequate sleep also are the possible ways to prevent heart problems. Uh, to conclude, it is important to remember that we can afford everything, but nothing is as precious as the health. It is possible to make heart healthy and prevent heart failure or heart attack through lifestyle interventions like dietary modification and exercise. By taking actions to lower blood pressure, one can help prevent themselves against the heart attack. Thank you.